And I must repeat that there is a cartel. This cartel, in 2018, we came out and said there was a cartel. You remember the ministry had declined. But you remember C.S. Kagwe came out himself and said that that ministry is full of cartels. And I think we have said not once that the cartel is alive and well. The cartel has its feet in KMPDC. It is body in SHA and its head is in Afia House. And decisions are being made by these cartels. The people who are supposed to be responsible are not doing this. And we have said that we are going to say it clearly and during the day. And if the president wants us to tell him what is happening, we will. We don't fear.
Forever, solidarity forever, solidarity forever, for the union makes us strong. Solidarity forever, solidarity forever, solidarity forever, for the union makes us strong.
Matabibu, viva!
Viva!
Afya, power!
Power!
Comrades, power!
Power!
Very well. Ladies and gentlemen, the members of the 4th estates, my fellow comrades, the specialized associations that we have here today, good morning.
Good morning.
Comrades, power!
Power!
Afya, power!
Power!
Matabibu, viva!
Viva!
My name is Wachira Peterson. I am the National Chair for Kenya Union of Clinic Officers, and I also serve as the Chair of Health Union Caucus. But today, we are here because, as you know, last week, we announced a 14-day notice. And today we are here with the people who know where the shoe hurts most. And from the onset, I must say again that it is very unfortunate that the practitioners of clinical medicine, the health practitioners, have to reach a point when they have to come out to fight so that they can be able to render the services that they went to school to be able to render to Kenyans. And most unfortunate that that also happens at a time when Kenyans are suffering, when we are unable to get to the destination that we set for ourselves, where then we can say that we are achieving the universal health coverage. Last week, we gave a notice on date 7, and we highlighted 2 issues. One of them being the discrimination and exclusion from the Social Health Authority. And today I want to just take a very short moment to explain to Kenyans what we mean by this. Because sometimes people do not understand and they think that we do these things out of selfish interest. It is a policy of the United Nations, a policy of the World Health Organization, that nations implement universal health coverage. This universal health coverage is underpinned by 3 principles. The first one being that every Kenyan, wherever they are, they must be able to access health services. The second principle is that the health service that they do access must be of good quality. And the third principle is that accessible health of good quality must not have catastrophic consequences to their financial well-being. That is what you say is all about. Now, when it comes to our country, we have put in place laws that are supposed to ensure smooth implementation of this. We have the Social Health Insurance Act. Under that act, it bestows the mandate to Social Health Authority, which is a board that is supposed to, number one, implement the social health insurance to ensure that every Kenyan is covered, and number two, and most important, to ensure actualization of the universal health coverage. The reason we are here today and the reason we are going on strike is because the Social Health Authority, in collusion with the cartel from the ministry and the Kenya Medical Practitioners and Dentist Council, have seen it fit to go against the tenets of the universal health coverage. They are denying illegally our facilities, our private facilities, 1,200 from being contracted and empaneled by the Social Health Authority. Number two, the people you see here, who are the leadership of the specialized associations and even the other clinic officers, have not been empaneled and recognized, and so they cannot offer services to Kenyans through Social Health Authority. Clinic officers are outside Social Health Authority. There is no Kenyan that we can be able to see and they benefit from Social Health Authority, and especially keeping in mind that more than 90% of Kenyans, we are the first people that see them wherever you go, whether in private, mission, or in public. And worse off, the same Social Health Insurance Act now compels every Kenyan to start from level 2 and level 3, where it's only a clinic officer who is the primary clinician you are going to find there. So simply, Kenyans right now cannot be able to access health services because clinic officers have been denied the rights to pre-authorize and to register their facilities. And that is why I'm saying the principle of access has been breached. The principle of quality, where these specialists offer their services, has been breached. And then these people have to get out of pocket to get these services. So we basically do not have universal health coverage. And it's a few people. The law is very good, but the few people sitting under SHA are the problem. And that is why we even wrote to the president and we're asking that that authority must be disbanded because they do not understand what they are doing. They are acting with impunity and they have become the biggest threat to the universal health coverage. That is one. Number two, you remember last year, we were on strike for 99 days under the county governments and 121 days under the national government. This strike ended after the Employment and Labor Relations Court under Judge Baira Mongaya midwifed an agreement that was then later recorded in court, and it's a document of the court, and it's an order of the court. All the county governments have breached that agreement. The ministry, we must commend them, because on the side of the agreement, only the CBA and a few of the contracts is remaining. They have done exemplary well, though they have not also fully implemented because we had a deadline of 1st of September. And it's because of these issues that we said by the midnight of Sunday the 19th, if they will not have been fully addressed, both of them, all the clinic officers from level 1 to level 6, and even 7 if it exists, I don't think it does in Kenya, will be going on strike. And when we cross that bridge, nothing is going to take us back until we have full implementation. We give 14 days so that we can give them enough time so that if they have goodwill, then they can be able to resolve these things. Allow me to invite a few people so that they can also put this into context, being that there are people who feel where the shoe pinches most when it comes to delivering that service, starting from our association, whose actually mandate is to look into the professional welfare so that they can give their remarks, and then from there we are going to have a few of the representation from our associations. Mayek.
Thank you. Good afternoon, ladies and gentlemen, and my colleagues. I'm Philomen Mayek, a representative from the Kenya Clinical Officers Association, and I will say that as a professional welfare body, we are not happy with what is happening to our members, and we are here to support, and most of the specialties, they are going through a hard time at this moment. So we are here to support and offer the necessary support to our specialties so that the government can listen to our plight and can also consider the clinical officers. We are the backbone of this nation. We are the drivers of UHC at the primary level. So we are asking the government to listen to us and to consider our plight. Thank you.
Yeah, thank you. Let us also have a representative of KMTC, and especially the ones who train these specialists. Senior Ngonjiri.
Ladies and gentlemen, good afternoon.
Good afternoon.
Now, I'd like to talk briefly about the training of clinical officers, because it's been mentioned in many instances that probably clinical officers are not well qualified to offer health services in this country. And it's a switch even a point some people think that the training of clinical officers should be stopped. Someone had even said it was a step-gap measure. And then after that, then you have other stopping of the clinical officer training. Now, I want to say this, and most of us are from the rurals. Where you have been being treated, you say, the doctor has treated me. I want to assure you, that person who was treating you was a clinical officer. If today all the clinical officers stop working, then no health services in this country will continue. The training of clinical officers, straight from the basics, that is the diploma, because that's the earliest program that started in this country, even before the training of the doctors. And then we have the degree, bachelor's, master's, and even PhD. And then you have the higher diploma specialties. They are the one who complement the consultants in the rurals where they are not available. And if we stop training these people, then the achieving of the healthcare coverage will be zero. The clinical officer training is not going to be stopped. And in fact, all over the world, even the developed countries, they are looking at how the training of the middle-level health workers, the non-physician clinician, can be used to help improve their health services. And those countries that have improved, including Cuba and even South Korea and even UK, they are using the non-physician clinicians, whom in this country we call clinical officers, but in the rurals, people call them doctors. When these are okay, nobody wants to say it's a clinical officer, is a doctor doing well. But when these go higher, they say it is because of the clinical officers. So ladies and gentlemen, let's support the clinical officers. They are the ones who are treating your parents. They are people who are treating your colleagues in the rurals, whether it is during surgeries, during delivery, ENT, reproductive health, the eyes, even including eye surgeries, orthopedic surgeries. We have clinical officers in those specialties. And even recently, is having oncologists, those who are treating cancers. So that's how the clinical medicine is growing. So it is not going to be stopped. It can only increase. And it's the high time that all of us, we support the clinical officers and we help them to grow in their profession. They are not quacks. They are professionals on their own, and they shelter their own profession. And they are not under anyone supervision or control or regulation. They regulate themselves, they register themselves, they train themselves. Thank you very much.
Your other name?
David Gunjiri.
Let's have anesthesia, anesthetist association.
Good afternoon, ladies and gentlemen.
Good afternoon.
My name is Ruth Wanjiro Mirore. I'm a clinical officer anesthetist. I am standing here as the national chairperson, National Association of Clinical Officer Anesthetists. I want to bring to your attention that clinical officer anesthetists offer more than 85% of anesthesia in this country. And SHA has discriminated us because we are unable to pre-authorize for anesthesia for our patients. And they have put other cadres to pre-authorize for us, and then we give the anesthesia, which is unfair to us. I should be able to pre-authorize for what I'm going to give. Clinical officer anesthetists work in all levels of hospitals that have theaters, even in Kenyatta National Hospital, MTRH, and Kisii Teaching and Referral Hospitals. We have clinical officer anesthesia giving anesthesia there. So we want SHA to give us that privilege to pre-authorize for anesthesia so that we can be able to give anesthesia to our patients. Thank you so much.
Thank you. Let's observe the representative from the nurse anesthetists.
Good afternoon, members of press. Yeah, my name is Samson Mireti. I'm a nurse anesthetist, the national chairperson representing my members in all 47 counties. I want to bring to this attention, especially to the media. Probably they have never known clearly who is nurse anesthetist. Nurse anesthetist is part of non-physician anesthesia provider. We are 3 cadres in the country providing anesthesia. That is the anesthesiologist, clinical anesthetist, and the nurse anesthetist. Actually, 80%, as my colleague has said, they provide anesthesia. The remaining is covered by our colleague, doctor, anesthesiologist. So I'm here to tell the country we are shocked and we are not happy with what is happening with the SHA. Previously, nurse anesthetists who are covering now 47 counties in various hospitals, all the levels providing surgeries. And they are regulated by Nursing Council of Kenya, licensed to practice as per their scope of practice. Previously, they have been pre-authorizing without supervision, but currently, the SHA management has decided to deny them that right, which they deserve. So we are here today to tell the country that the population of nurse anesthetists, clinical anesthetists in daily needed, as the hospitals are now increasing. But if the SHA decide to go the way they want to go, the surgeries are likely to be delayed, especially in private mission hospitals, which purely depend with these 2 cadres. So we are kindly requesting our union in the 7-day notice, if they are clear not listened, they will be also joining their members, nurses, in their strike scheduled for 19. So that's why now we are come to play the country, to listen, to know that 80%, if not taken care, our members, our client, the country is not safe. Thank you very much, members. And remember, you are safe with the team you can see here. Thank you very much.
Thank you. Let us have reproductive health.
Good afternoon, ladies and gentlemen.
Good afternoon.
My name is Mutumangera. I'm a clinical officer, reproductive health, representing reproductive health clinicians as the Secretary General countrywide. So for us, we are really saddened by the shift of SHA and shift of policies. For previously, we have been offering services under NHIF, which was going well. We have had no complaints. But what has happened out of nowhere? We are really saddened, and we believe we are the primary health care workers who are down there and offering the right services, doing the right referrals, and doing what is supposed to be done as per our guidelines. We are specialists, and we have been doing this for a long duration. So why is it now that out of nowhere, things have changed? And we don't understand it. No one is listening to what we are going to say. So we support our union in totality, and when time comes, then we have to take action. Putting in mind Kenya, maternal mortality rates are 549 in 100,000, which is very high as per our WHO guidelines. And we feel that these people in SHA are really not conscious about what Kenyans are going through. Many people are using out-of-pocket monies, and we don't understand what is really happening. Do people really care about the Kenyans' welfare? This is the question that we're asking each and every day, and we hope it will be answered soonest possible. Thank you.
Thank you. Let us have Association of Orthopedics.
I'm Cicely Gakono, orthopedic and trauma surgery. I'm representing my members. Okay, maybe my members, my colleagues have said a lot. I just want to say the challenges we are facing in orthopedic. Even a simple case of a patient who has a trauma we cannot even be able to send for a simple test like X-rays, no, not X-rays, maybe MRI. We cannot be able to do a CT scan because we are not able to authorize. We have to wait for a consultant who will come after 1 week or 2 weeks. Maybe the consultant is on leave. This patient has to be transferred to another place. So we're having so many challenges. I don't know why the SHA they have a cartel. Let us say it's a cartel because they want to deny us they want to deny the clinicians, and they also want to deny the patients their rights. We are hoping this strike is going to be, we are hoping we are not going to a strike. We are hoping they are going to listen to us. We are pleading to the president to listen to the patient and to listen to the clinician. We want to offer the best to the patient, but we are not able. Our hands are tied. We really need to work on this. Thank you.
Thank you. Lastly, let's have the COPA and the Dermatology Association.
Good afternoon. I'm here on 3 accounts. One, I'm a clinical officer dermatologist. I'm called Austin Oduor. I'm also the president of the International Association of Clinical Officers and Physician Associates. It's called GACOPA. And I'm also the National Deputy Secretary of the Kenya Union of Clinical Officers. So most of the things about the specialties have already been talked about. And even as a dermatologist, I'm representing the chair. You realize that even the monkeypox outbreak, we were not involved. Yet, 90% of dermatology cases are seen by us. There are roughly around 20 dermatologists in Kenya. The rest are clinical officer dermatologists. When an outbreak like that, neglected tropical diseases, they look for other people are the ones doing those. Yet we are here and they can't even empanel us because this issue is going to affect Kenya. And I can see Africa News is here. Africa News is watched all the way up to Equatorial Guinea, to South Africa. So this thing should sink down, down, down. It is not only in Kenya here, where an attempt by some cartels in the respective Ministry of Health to downgrade clinical officers. It's happening in Zambia, and it is time we wake up. As the president of the Clinical Officers Association, I want to say that clinical officers in other countries called physician associates exist in 78 countries in the world. And of the 78 countries, 70 of those countries, and recently, Puerto Rico just wrote to us that they want to join our international association and that physician associates are doing a good work in Puerto Rico. So, hapa Kenya, ndio sasa wanasema clinical officers hawawezi. Yet clinical officers are doing complex surgeries in Malawi. 90% of the surgeries done in Malawi are clinical officers. In fact, if clinical officers down their tools in Malawi, then the country will go into, the country will sink. Because all the surgeries, 90% are done by clinical officers who are specialized in general surgeries. All the anesthetists in Malawi. Botswana has only one anesthesiologist. Botswana has only one anesthesiologist. The rest are clinical officers. What are they doing there? Have you ever even heard of cases of mismanagement in Botswana? It's a country that is doing well. We find they are there in South Africa, all these countries. So we are saying this is the time. And on 19th, if the government cannot come and listen to us, then we want to show the government, and we are telling the president that even the people you put at SHA, you keep on changing them day in, day out. All those people are incompetent. There is no way you can get someone from KMPDC sitting in the board of KMPDC to sit in the board of SHA representing KMPDC, yet 90% or all these specialties that we are talking about are done by clinical officers. So we are saying enough is enough, and we are calling it and shouting it to the entire world, to Africa, from Johannesburg to Cairo, to Accra, Ghana, to Lima, Peru. We are saying that on 19, all roads, we'll tell all our members not to go to work, and then we will see what happens after that. Thank you.
Asante, sijui kama kuna maswali.
Apart from the fact that services are delayed,
Yes.
is it a battle of money for you to approve these services? Do you get something? Do you feel that you are being sabotaged by the
I must say that there are many things at play here. Number one, there is an obvious privatization agenda. There are people who are trying to make the public health sector to fail so that the privates, and it's unfortunate that we are having many of those people who are supposed to take responsibility opening up and owning private facilities. So there is that agenda of privatization, of course, so that they can get money from this scheme. Number two, there are people who have brought their selfish interests. They want to mask everything that is done by clinic officers and take credit so that when the data is taken from SHA, then it will seem like clinic officers do not do much. So there is also that interprofessional fight by a very few. But then we are not here to condemn doctors. Doctors are very good and we work together. But there are few rogue officers within the ministry and KMPDC. And I must repeat that there is a cartel. This cartel, in 2018, we came out and said there was a cartel. You remember the ministry had declined. But you remember CS Kagwe came out himself and said that that ministry is full of cartels. And I think we have said not once that the cartel is alive and well. The cartel has its feet in KMPDC. It is body in SHA and its head is in Afia House. And decisions are being made by these cartels. The people who are supposed to be responsible are not doing this. And we have said that we are going to say it clearly and during the day. And if the president wants us to tell him what is happening, we will. We don't fear. Because the health of Kenyans is paramount. Article 43 of the Constitution guarantees every Kenyan right to health. Article 24 of that Constitution guarantees every Kenyan the right not to be discriminated. The Social Health Authority is discriminating clinic officers. It is discriminating those people, the patients who are supposed to be seen by clinic officers because they cannot be able to get their health care. And by this, it means they are not fit. And that is why we are calling for the disbandment. And that is why we are calling it a cartel, because a cartel goes against the law. Because they are doing this with impunity, it is going against the law, and we are saying, if then somebody is going to make UHC fail, either because of impunity, or lack of knowledge, or selfish interest, the three grounds are enough grounds for them to be removed. We are not also stopping here. We shall be writing to the Speaker. We are doing a petition to the Speaker with full grounds, and we are collecting signatures to have these people removed from the office. If you can disenfranchise Kenyans going against the law because of your selfish interest, you do not deserve to hold a public office. And we are going to take the first step because as Kenyans, we must be responsible citizens and we must ensure that those who go against the law must be held to account. It is illegal. It is illegal where you find that, let me give an example, like what is happening to anesthetist. You are the one with the knowledge, you are the expert. But then the pre-authorization is done by somebody else who do not understand what you are doing. So when you go to SHA, what reflects there is that that medical officer whose license was used is the one who gave the anesthesia. So it is basically illegal. And that is why we are saying it can only be three things. One, impunity, and we are very sure because we have approached them and we have shown them the right position of the law. Number two, ignorance. And ignorance is not an excuse. And number three is selfish interest. And the three grounds are enough grounds to remove these people from the office.
Yes. Have you thought of maybe not doing these procedures at position so that at least mwachie madaktari kama hawezi kuja mgonjwa akufe?
You know, what we do is that as health workers, we have a lot of ethical considerations, and we are also humans. So sometimes before we get to a point where, because, you know, when we reach to a point where we are not going to do that, and that is what we are going to do on 19th, we want to be sure that we tried all that we could do, because we don't feel good when our patients are suffering. And that is why we give the government 14 days. We don't want to do that, because I can assure you, the day these specialists will say that we are not going to offer procedures because of this, Kenyans are going to die. We have many critical and emergency care clinic officers who are right now in casualties, who are attending to accident victims. They want to put the central line. They cannot be able to pre-authorize. If that person declines to do that, that patient is going to die. And that is why we are a bit slow, because we also care for Kenyans. And that is also why we are also calling on Kenyans that, especially at a time like this, when we are coming out, not for anything else, but to advocate that we are given the rights to render the services to you, Kenyans must be able to join us, because it is for them that then we are in this battle. But then what we are saying, this is one fight where we must win whatever comes may, because the alternative means that Kenyans are really going to suffer. That is not what we took the Hippocratic oath to do, and we will ensure that Kenyans get their rights.